This Good Morning Washington Spotlight on Your Health is sponsored by George Washington University Hospital.
Some staggering numbers according to the Colorectal Cancer Alliance. Each year, about 150,000 Americans are diagnosed with colon cancer. But it can be prevented through early screenings. So joining us to talk about colon cancer awareness and early screenings is colon and rectal surgeon, Dr. Marian Khalili. Welcome to Good Morning Washington.
Thank you so much for having me.
Absolutely. Let's dive right into this conversation. Tell us the key risk factors and how important that early detection is.
Sure. So the risk factors for colon and rectal cancer can be divided into two groups. We have the things that we can change and the things that we absolutely have no control over. So the things that we can change are we can stop drinking alcohol, we can stop smoking cigarettes, we can avoid processed meats, so that's the deli meats and the Slim Jims. You can increase the fiber in your diet, so make sure that you're getting plenty of multigrains, fresh fruits and vegetables, and increasing your physical activity, so exercising. And then there are things that you absolutely have no control over. So that's your family history.
Yeah.
If you have a family history of colon cancer or colon polyps, if you have a personal history of colon cancer or colon polyps, you're more likely to get another colon cancer. And there's inflammatory bowel disease. So these are Crohn's disease or ulcerative colitis. They also put you at increased risk. And of course, your age. The older you get, the more likely you are to get colon and rectal cancer.
And how important is those early screenings?
Oh yes, so the early screenings are critical. And the reason why is because we don't only screen for colon cancer, we actually find it early or find precancerous lesions and we remove them and we prevent cancer. And that makes colon cancer screening really unique. And overall, since the introduction of colonoscopy, there has actually been a reduction in the incidence of colon and rectal cancer.
Can you talk about the screening options and how frequent we should be doing them, how they are different?
Okay, so I'll start with colonoscopy because that is the best screening tool that we have. You should start doing colonoscopies at the age of 45. In fact, you should start screening for colon cancer at the age of 45. And you want to do them anywhere from 3 to 10 years, depending on what your risk factors are and what's found in the colonoscopy that you've had previously. And so what it entails is taking a prep. That's the absolute worst part. And you get a camera put in your bottom and we take a look at your entire colon. If we find any polyps, we remove them. If we find any cancers, we take biopsies of them. Or polyps that are too big to remove, we take biopsies. And again, really important because it prevents cancers. There are also stool-based studies. We can look at your stool for blood and also tumor DNA. And that is, Cologuard is an example of that. Just the important thing with Cologuard is that if it's positive, you have to get a screening colonoscopy. You can't just avoid the colonoscopy in those situations. And the Cologuard you have to repeat every 3 years.
Okay. So I know with everything there's always misconceptions and barriers that patients can face. Can you talk about those and how healthcare providers can really work their way around them?
Sure. So, one important thing is making sure that our patients have primary care providers and they're going to their primary care providers because that's the person who kind of controls all of the care that you have access to, right? So it's not just colon cancer screening, but it's screening for a lot of different cancers. I think the important thing is education. So, if we educate our patients, then we empower them to advocate for themselves. And if they know that they're supposed to be getting a screening colonoscopy at the age of 45, they know to ask for it. So those are the big things.
Yeah, you've made it so digestible, and I think a lot of people are like, I need to work on this and work on it now and do it early. Thanks for sharing this important information here on Good Morning Washington.
Thank you so much for having me.
Absolutely. The information is on your screen so you can learn more all about this. Thank you so much.